Locking plate and screw fixation is a surgical technique used to stabilize fractures or reconstruct bones in orthopedic surgery. It involves the use of specialized plates and screws designed to provide strong and stable fixation. The locking plate and screw fixation utilizes screws that have a threaded portion near the head, which interfaces with corresponding threaded holes in the plate. This creates a locking mechanism, preventing the screw from backing out and providing a more rigid fixation. The main advantages of locking plate and screw fixation include 1. Enhanced stability. The locking mechanism between the plate and screws creates a fixed-angle construct, providing increased stability compared to traditional fixation methods. This is especially beneficial in osteoporotic or comminuted fractures where the bone quality may be compromised. 2. Load distribution. Locking plates have multiple holes along their length, allowing screws to be placed at various angles. This enables the distribution of forces across a larger surface area of the bone, reducing stress concentration and promoting better healing. 3. Preservation of blood supply. Locking plate and screw fixation does not rely on compression between the bone fragments, which helps maintain the blood supply to the fracture site. This can be particularly important for fractures in areas with limited blood flow, such as the distal tibia or femoral neck. 4. Early mobilization. The stability provided by locking plates allows for early mobilization and weight bearing, which can facilitate quicker recovery and rehabilitation. Locking plate and screw fixation is commonly used in various orthopedic procedures, including fracture fixation, osteotomies, and joint reconstructions.